Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care. Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with Christie Gonzalez and Cordia Losh, who serve as executives at WellSpace Health, an organization that's been serving the Greater Sacramento community for over 70 years when it comes to behavioral health services, suicide prevention, medical clinics, and serving the Medi-Cal population. In today's episode, we learn of the many services of WellSpace Health, including how it got started as a suicide prevention hotline and how now it serves as the largest Medi-Cal provider in the Greater Sacramento area. We also dig in a little bit to learn more about WellSpace Health's different community clinics and sobering centers and just the impact they have by impacting over 100,000 individuals each and every year. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking us out on our YouTube channel, or listening to us wherever you listen to your shows. Thanks, everybody. Enjoy today's episode. Hello, Christie. Hello, Cordia. Welcome to the show.
Thank you. Happy to be here.
Yeah, happy to have you guys on the show. So audience, I had the opportunity to meet Cordia probably about a month and a half, almost 2 months ago now at the Northern California State of Reform Conference, where he was a speaker during the conference, and he shared quite a bit about the impact that WellSpace Health is having in Northern California. And it was very impressive. Candidly, I had not heard much about WellSpace myself in the past, and I'm still learning about Northern California. But it was pretty impactful for me to hear about what they're doing in Northern California. So Cordia, appreciate you joining, and Christie joining as well. As we kick off the show, before we jump into WellSpace, Christie and Cordia, we like to get to know our guests a little bit. So Christie, let's start with you. We always like to start with a fun fact, preferably something outside of healthcare if possible. But can you share like a fun fact, a hobby, something like that about yourself?
Absolutely. So maybe a fun fact about me is just that I play 4 different instruments, musical instruments. And I always like to say that serves me well professionally, because part of playing an instrument is you have to have your instrument correct. You have to play the right notes. You have to come in at the right beat, but you also have to know how to listen to each other, and you have to know how to play as a part of a whole. So I like to think that serves me professionally, because it helps me understand what's my role, what's my accountability, but really how do we all get together in the landscape?
Love it. And really quickly, what are those 4 instruments?
Flute and piccolo, which are very similar, and then very differently, baritone and euphonium, which are similar to each other as well too. So
I don't even know.
Euphonium. Yes, it's like a mini tuba.
That is awesome. And do you like play a recreational, like in a band or anything, or like a church or band or something like that?
Just recreationally, and not as much as I used to in my early days.
Okay, that is awesome. Cordia, that might be tough to beat, but let's go to you.
My name is Cordia Losh. I would say my fun fact is I own every baseball card from 1974 right now up through 1989. So if there was a baseball card set and a baseball card available, in the primary sets, the Topps, Donruss, Flair, Worlds. I don't have all the Mother's Cookies cards. I have a lot of them. But I'm a huge avid baseball card collector from the 70s and 80s.
That's amazing. So do you have the Beckham pricing guides as well from back then? Or
Beckett? Oh yeah, I still have the old issues of Beckett. Yeah, that was my best friend and I used to go down every month, buy the Beckett and go through and categorize and track our cards. So
okay, so I am not even close to as many baseball cards as you. I have like 4,000 cards that I thought was a lot. Do you know the actual number of approximately the number of cards you have?
I've never counted them. I would say I probably have over 10,000 baseball cards easily somewhere packed away in my office. Yeah. My wife now works from home, so she's surrounded by my baseball cards. So if you're on a Zoom with my wife, behind her is like all the Rickey Henderson baseball cards, because that was my favorite player. So I keep them all right behind where she sits now.
Well, you're from the Bay Area, and he played for the A. So my first glove was a Rickey Henderson glove.
Yep.
And he threw left, batted right. Correct.
Yep.
No wonder my dad said
most leadoff home runs, most runs, most walks. Yeah, Rickey is he was my favorite player to watch. So still a huge big Rickey. I got all the jerseys. Yeah, I'm that guy.
That is awesome. Well, let's stick with you then, Cordia. So before we get into WellSpace, we know about your passion for baseball cards that you had at a young age. Tell us, growing up, did you grow up? It sounds like you grew up in the Bay Area. Kind of walk through that journey of ultimately getting into maybe policy and serving older adults, and ultimately at WellSpace.
Yeah, sure. I grew up in Grass Valley, California. So, it's Sierra foothills, if you're not familiar with it. And if you are, usually in California, it's basically right in the middle between Sacramento and Reno, up in the Sierra foothills. I was born in the Bay Area, but my family quickly migrated to Grass Valley. So I went through I am a product of the Grass Valley Unified School District from kindergarten all the way through high school. I'm a graduate of Nevada Union. When I graduated from high school, I meandered through college, I like to say. Eventually, I ended up at the University of California, Davis, where I graduated with a degree in political science. Prior to that, I found my way into a lot of odds and ends. I was primarily a paralegal. My aunt got me involved, so that's where I think I found my fondness for policy and law. But upon graduating from college, after working for attorneys for a number of years and working my way through school as a paralegal, I decided to go to business school instead. So I have a MBA from St. Mary's College. How I got here in healthcare, because I didn't want to go into law, and I really thought I was. I worked at the state of California, so I worked for the Department of Managed Healthcare. Not because I had this love of healthcare early on. It was a job that I can get at the state. But the way I looked at the state of California, it was like going to college. Everything is at the state. It regulates all aspects of California. You can go into nature, you can go into healthcare. I worked in recycling and environmental for a while, which was really fun. But at the end of the day, I did actually like the mission of the Department of Managed Healthcare. It is by far the largest regulator of healthcare outside of the federal government. 95% of Californians are regulated through the Department of Managed Healthcare. So I got to spend about 8 years at the Department of Managed Healthcare working with healthcare policy. So, working on licensing structures, working on, regulating health plans to make sure that they had the adequate networks to provide the services to their patients that they promised publicly. So I got to do a lot of that oversight. After a while, I wanted to grow. I wanted to learn more in healthcare. So I worked at Anthem, a very large health plan. And then I worked at a local IPA in town. An IPA is an independent physician association, similar to a health plan, just they do risk on certain services. And then I landed here at WellSpace about 3 years ago. And what brought me here was just the mission. And I think Christie's going to be able to touch and enlighten all of that. But everything we do here at WellSpace is for the patient population. So I know even on the hardest days, maybe indirectly, if we can do and make a difference in someone's life or make our region, have more accessibility or broader access to services, then, it's a good feeling. So that's what brought me here and what brought me into healthcare.
That is awesome. You've done a lot, but the way you kind of button that up, I appreciate very nicely. Let's go over to you, Christie. What was your journey, as a child up through joining WellSpace, where you've been, I believe, about 20 years now?
Yeah, so I'm Christie Gonzalez. I'm Chief Program Officer with WellSpace Health, and I have been with WellSpace Health for 20 years. I'm actually celebrating my 20th anniversary this summer with WellSpace Health, and it's pretty unusual these days for someone to kind of have their whole career in one organization. Maybe 50 years ago, it was a little more common, but it really started. I grew up in the Bay Area, so I grew up in the Santa Clara area. Went to Mission College, went to San Jose State, go Spartans. And this was in the late 90s. This was in the early 2000s. And this was when the Intels and the Googles, were taking over. And I pretty quickly realized I was probably going to be priced out of the Bay Area. So I was an early refugee of the Bay Area and fled to the Sacramento area, as a lot of people do. And I really made it my home. And this is my adopted home now, and I'm a very proud Sacramentan now. And the thing that really drew me to healthcare, when I was at San Jose State, I was getting a social science degree because I thought to myself, well, I'm pretty good at talking in front of people, so maybe I'll just be a teacher. And that was my 19-year-old logic about choosing a career. And it was actually my very first class at San Jose State where I took a class about social justice and racial tensions with a lens on education. And as soon as I took that class, something just clicked in my head and I said, I want to go into social work. I want to go into the social sciences. I want to go into social work. I want to be a part of what it means to help people and what it means to get people from a place of crisis to a place of healthfulness. And at WellSpace Health, I feel like I've really had a chance to explore that over my last 20-year career here. Started out as a supervisor of a child abuse prevention program, and then moved into our federally qualified health center health system work. And so coming from a social work lens, I didn't understand, managed care plans. I didn't understand insurance. I didn't understand that, but I learned it. I picked it up on the job. And what I learned is there's such a big connection between physical health and what we now call social determinants of health, right? Because you can only talk to a parent of a pediatric child about how important it is to go get your immunizations if they're like, do you know how much money I had to pay to get me and my 5 kids here? And do you know how much work I had to miss? And do you know how many buses I had to take to get here? And do you know that even now I'm talking to you through a translator because maybe English isn't my first language? And so to me, it just made so much sense. Healthcare can only be a focus once we have wrapped a patient in those social determinants of health support, in the translation, the transportation, the health literacy of it all. And so now, being a chief program officer, I have the honor of working with our behavioral health departments. So a lot of our suicide prevention work, WellSpace Health is the provider of the 988 Suicide and Crisis Lifeline in the Sacramento area. We're the second largest 988 call center in the state of California. You wouldn't know it, right? WellSpace Health, Sacramento, but we are. We're also building out a state-of-the-art crisis receiving center when people are actively intoxicated or inebriated or in the middle of a mental health crisis or a psychotic episode, rather than going to the emergency room and sitting in a bay, for 24, 48 hours waiting for a bed for a 5150 hold. Instead, they can come to us and just have a moment of respite and be connected to those ongoing services that they have. And so for me, my journey of healthcare was really about the person. It was about how do we make sure that the person who is the patient is really wrapped in all the supportive services they need so that they can focus on their dental health and on their immunizations and all those more kind of usual CPT things.
Yeah, interesting. So when you let me go back. San Jose State University. I don't know if they still play football there, but there's a team now known as the San Jose Earthquakes. Back then they were called the San Jose Clash.
Yes.
I think. And so I'm a big soccer guy, even though I have a bunch of baseball cards like Cordia, although not as that is solid, man, like what you have. I'm a huge soccer guy. So I watched, I'm not good enough to play anymore, but I watched the LA Galaxy play San Jose Clash in your stadium, and those fans were definitely rowdy. So
San Jose does everything rowdy.
So you joined 20 years ago. And it was funny when I first talked to Christie off the air, I was like, you've been the chief program officer for 20 years. And she corrected me, she started there 20 years ago. So what was your first role at WellSpace, Christie?
I was a supervisor in a child abuse prevention program. So we ran a series of family resource centers, helping families with children aged 0 to 5 years old, to just have really healthy parenting skills and to be connected with resources they might need.
Thank you. You did tell me about the child abuse as kind of the work you did, but I appreciate you clarifying your specific role. So you've been there 20 years. You kind of gave a little bit of a preview of some of the things WellSpace does. So I'll continue with you, Christie, but Cordia, feel free to jump in. Keep in mind our audience is all over the country, a lot in California too. But could you give like a general overview of what is WellSpace Health? Even though our audience is usually pretty educated, maybe speak to the audience as if it was the general public about what you guys do.
Christie, please, and I'll supplement.
I will.
Okay, cool. Yeah.
So WellSpace Health, in simplest terms, is a federally qualified health center and a system of community health centers. But that's really selling us short. That is not really understanding the depths of what WellSpace Health does, specifically in the behavioral health space. So we're actually celebrating our 70th anniversary this year. We were founded in 1953, and the program that we started with in 1953 is a suicide prevention hotline, and that is still going to this day. So for 70 years, we've been operating that suicide prevention hotline in Sacramento. And for a lot of those 70 years, we were actually a really large behavioral health provider. We did our suicide prevention hotline. We did substance use treatment, everything from inpatient treatment to outpatient treatment to perinatal treatment. And then we were also a really big provider of mental health services, counseling, psychiatric care, all that really great behavioral health stuff that for a really long time was not thought of as integrated into a physical healthcare or a primary healthcare mindset. And so in about 2004, 2005, WellSpace Health started to become a federally qualified health center lookalike, ultimately obtained federally qualified health center status. And so while a lot of people in the Sacramento region know us as the largest system of community health centers and federally qualified health centers, that's actually the newest kid on the block as far as services we provide. And that's what makes WellSpace Health unique, is not only do we have over 135,000 patients that we serve every year, not only do we have 1,500 encounters every day across the many different services we have, but we are a really large integrated behavioral health and primary health care system. And so really knowing how we started is important, because I think there's a lot of primary care clinics and a lot of primary care FQHCs that are just now in the past few years talking about how do we incorporate behavioral health into our operations. We actually did the opposite. We said we do behavioral health. How do we incorporate primary care into us? We think we've done a pretty good job at it.
Yeah, that's great. And Cordia, feel free to add anything in a second. Just to clarify, Christie, the counties you serve, Sacramento, Placer, and Amador. Am I missing anything?
That's correct.
Okay. Cordia, anything to add on kind of just the general overview of who WellSpace is?
No, I think Christie captured it, relatively accurately, and like she always does, and very, 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 very specific. What I would say is, when I think about WellSpace, how it is unique in our region is, and Christie said this, it's an integrated model really for the Medi-Cal member. And sometimes the Medi-Cal membership, they have different demands as maybe a Kaiser would. A Kaiser is an integrated model. Kaiser is for the commercial patient, Medicare Advantage patient, and it's really tailored to those needs of that patient population. They do Medi-Cal, not nearly at the highest clip that they do. And a lot of the Medi-Cal members at Kaiser were formerly commercial members. So they're kind of also, they understand that model. And what you see here at WellSpace, it is for that Medi-Cal member. I mean, we have primary care. We have women's health. We have pediatric dental. Soon we're going to have adult dental. And then we have the number of services that Christie operates here at WellSpace. And what that does is that is tailored for the Medi-Cal member. And what you have to think about Medi-Cal, it is unique when we think about service lines. About 5% of the Medi-Cal population has, what is referred to as maybe comorbidities or, maybe multiple diagnoses. A lot of times that has to come with, behavioral health, and that they need treatment for that. That 5% is really 50% of the Medi-Cal spend that you have on the state. And that's really where WellSpace is focused, and where our CEO has always grown this organization is it's not the low hanging fruit, it's the high hanging fruit. We want, it's not, we don't say disadvantaged, we say most deserving of care. We don't say, safety, we don't say safety net because it has holes in it. We say blanket of care. And I think that's with Christie and her programs, and what we've done with our behavioral health services is really create that integrated model for the Medi-Cal patient, and the services that we offer and how we interact with our patients are really focused on that.
Yeah, I love the adjustments of the wording that you mentioned, like most deserving of care, I believe is what you mentioned, and a blanket of care instead of safety. Now that's really cool. I've been around for a while, but I've never heard those terms, and that's great. So what's interesting is, like some other not-for-profits that have been around as long as you guys. Medi-Cal, I'm guessing, is your biggest payer today, or the different managed Medi-Cal, I guess you can say. Is that true? Or do you, is there, I know you're probably funded by different sources besides Medi-Cal too, right? Or managed Medi-Cal?
Yeah, but our Medi-Cal, our patient population is primarily Medi-Cal based. So about 84% of our patient population is Medi-Cal. And then we have a mix of Medicare and commercial patients. We do see commercial patients. That's the thing about WellSpace. We see everyone. And that's why our motto is everybody deserves to be seen. But primarily, again, where our focus is at is about 84% of that patient population that we see annually is going to be a managed Medi-Cal patient. Also, about 10% of our patient is uninsured. So, generally what you're going to see with WellSpace is because of the number of number of centers that we have in the regions that we serve. And specifically with a lot of those programs that Christie works with, because we have the unhoused street nursing program, a lot of the CalAIM that we're going to touch upon is that, we do end up with maybe a higher portion of uninsured, but that's also what the FQHC mission is about. Yep. It's not necessarily about managed care. It's a community health center. And what we are is that when you walk in the door at a community health center, it's the same as when you go to an ED. We will see you when you come in. And it doesn't matter whether you have insurance or not. It doesn't matter whether you want to use your name or another name. All we ask is that you stay consistent with the name that you use. Yeah. But we're going to see and we're going to treat everybody. And I think one of the really the secret sauce is when you come here maybe for primary care services, we can link you into the number of services that Christie has. And again, start to, not just do primary care, but really kind of do that integrated work that those patients do and may need. Am I right on that, Christie? Did I miss anything?
Yeah, the only thing I would add to that is that over 5% of the WellSpace Health population do identify as being unhoused or experiencing homelessness in some way. And so it really is, as Cordia mentioned, it's about that idea of we will see you no matter what, regardless of your ability to pay. And not only that, but we're going to provide you with that top-notch service. We're going to provide you with the same high-quality comprehensive health care that someone with insurance would have. We don't have some sort of two-tier healthcare delivery system. Every patient receives that same care.
That's really neat. So Cordia had touched on, and I asked Christie and Cordia if we could kind of touch on their CalAIM services prior to the recording, and Cordia just hinted at it. And now, Christie, you mentioned unhoused, which kind of gets me thinking of all the different housing community supports and how ECM organizations are now, serving those experiencing homelessness. So can we talk briefly about WellSpace's efforts in the California Advancing and Innovating Medi-Cal, or CalAIM world? Christie, Cordia, feel free to jump in.
Absolutely. So WellSpace Health plays a lot in the world of ECM, which is enhanced care management, which is really focused on care coordination and case management for some of those managed care plan members. And we also live in the world of the community supports. And the community supports are more kind of on demand as opposed to a case management or a care coordination like that ECM is. And we offer the most ECM services in our region to the most patients and assigned lives in the region. And we also offer the most community supports in our region as well, too, including some of the supports that are a little harder to start up. If there was a provider in the community that wanted to start up, say, a sobering center, that might be a little bit harder to start up because you need to site it, you need to staff it for 24 hours a day, that sort of thing. So we offer sobering center community supports. We also offer recuperative care, also known as medical respite care. This is the concept that if someone is experiencing homelessness and they are about to be discharged from the hospital or they're at risk of hospitalization, they can come to that recuperative care center and receive that medical respite care for 30, 60, 90 days, whatever it is that the health plan may authorize. And so those are the types of community supports that might be a little bit harder to get going in some of those California communities where they don't already exist. WellSpace Health has been operating a recuperative care, medical respite care model for almost 20 years. So for us to transition to CalAIM, it was actually more about a funding mechanism than it was about starting a new service.
Awesome. And so those medical respite centers have been utilized, I'm assuming, and I'm thinking of other counties that I'm more familiar with. So like the hospitals, for example, there may be someone who's not necessarily appropriate for an acute stay, but they were there for a little bit. Maybe it's appropriate for them to go to medical respite instead at a significantly lower cost.
That's exactly right.
Yeah.
So the concept behind the community supports, when Department of Healthcare Services actually started announcing what kind of services they would consider, they actually used a different term than community supports. They started with a term called in lieu of services. Yeah. And the concept behind the name of in lieu of services was exactly that, of what kind of supports could we provide in lieu of those higher cost services, the inpatient at the hospital, the skilled nursing facility. And one of those services is exactly that medical respite care. So you or I, listening to this recording, if we, God forbid, were to go into the hospital and we had a short stay and we were well enough to be discharged home, That is not what our unhoused neighbors can go home to. They can't go home to a bed. They don't have a refrigerator to keep their medicine, cool. They don't have air conditioning. They don't have heating. They don't have a loved one who's going to monitor. Does that wound look infected? Are you taking your medicine on time? And so these community support providers like WellSpace Health providing this recuperative care service, we act as that loved one. We make sure they're taking their medicine on time. We check their wounds to make sure that they're not being, getting worse. And we make sure that they have a safe place to recuperate.
That is great. So, Cordia, you're Chief Strategy Officer. I mean, it seems like you guys do everything. What are you working on if you guys already do everything?
So what's really cool is my job is I get to strengthen and really work closely with individuals in our organization like Christie. I remember when we looked at this. I actually remember the meeting. It was about 2.5 years ago. I was sitting with Christie and one of her deputies, and we were reviewing the CalAIM program, and we were like, we already do all of this. We were doing all of these services, prior to it. So when we started on CalAIM, it wasn't, what we wanted to do. All we had to really work is how do we operationalize this and expand it, because we knew it was going to be expanded. The medical respite at a location that we refer to as the bunker, that was already in the process of being built. We were already starting our sobering center, which we refer to as the crib. So that's what was really interesting. And then what it comes down to, what I like to say I do is I handle, the bureaucracy of healthcare on my end. What I want to do is be able to take that bureaucracy, work through those contracts, work through those numbers. So Christie and her team can focus on making these services the best for their patients. I want to work on, how do I work with these partners that we have, mostly primarily our health plans, and also the other community support providers. WellSpace is the largest, and as Christie says, we do provide a lot of these services, and we are really, for a lot of these services, specifically medical respite, kind of the only provider right now in our region. But what we have to understand about CalAIM, and Christie will agree with me on this one, is it like healthcare. If you think of specialty care, it is a network of providers that provide these services. You have independent gastroenterologists, independent cardiologists, independent urologists, and they all come together to create that network of care. And I think that that's really where CalAIM's going. We are the largest provider of these services, but we can't be the only provider of these services. And I think that's where CalAIM's going. So, again, working with a lot of those outside partners, but again, being WellSpace is that we had those connections and those relationships with a lot of these entities already, mostly with the housing transition. So that's what I really enjoyed about Sacramento. We were able to already we weren't building this from scratch. I think what a lot of counties have experienced with the CalAIM program, we just had to strengthen our program. And I think that's what we've been doing since then.
That is great. So since you guys have been doing this for a while, you probably started with CalAIM when it went live, since you already had the programs in place. Are you able to share maybe a story, or besides just like numbers and lives impacted, are you able to maybe share with the audience a story, something we can all relate to about the impact, whether it's CalAIM related or not, with WellSpace?
Yeah, absolutely. So protecting PHI, of course, I'll call the patient Jose. So Jose represented a lot of what we see in our homeless population. He was over 50. He was in his 60s. He was a veteran and had served, and he had experienced homelessness for the first time after the age of 50. And that's quite common in a lot of California homelessness numbers. And so Jose came to us because he was discharged from a local hospital. He stayed with us in our recuperative care for 90 days. And while he was with us, he was actually connected to the CalAIM service of ECM. So all that care coordination work and all that case management work went into play. He was also connected with our community support service of housing navigation. So rather than just saying, thank you, you have rested for 90 days at recuperative care, now you're released, back out onto the street, it was saying, let's figure out what housing looks like for you, Jose. So in addition to the care coordination, we got him established with his primary care provider. We got him followed by his cardiologist. And then through the housing navigation, we were actually able to find him an apartment where he was able to rent an apartment market rate with another person who was graduating from our recuperative care. And together they were able to afford afford the apartment. And so we were able to work through with them, help them with their housing deposit, which is another community support through CalAIM. And upon discharge of our recuperative care, was able to move into an apartment with a roommate. So he is the biggest success story, I think, of what can happen with CalAIM, of what can happen when the authorizations for services go smoothly, of what can happen with the connection to the community supports, both in healthcare, but also outside of healthcare, thinking about housing, thinking about benefits, thinking about the Department of Human Assistance. When all the systems can really be coordinated through CalAIM, we can actually make a difference in individual patients' lives.
Awesome. And that's the cool thing is whether you're like WellSpace and have all those services, or it's other organizations partnering together, like that's the intent of CalAIM and how it's working. So really cool about the success there. Cordy, from your lens, anything else to add on what you've seen as a success story? Or is Jose kind of like a good prime example?
I think Jose is a good prime example. I know that, when I'm over at, our medical respite, again, referred to as the bunker, there hasn't been one time, and I feel like we're over there quite often. There's not one time where multiple patients don't walk up, they shake our hand and they say that, this made a difference. I had nowhere else to go. This is what's helping me change my life. This and the services that you provide, and it's the many things, and it's humbling because it's like, I am just a very small part of this, but you could see the appreciation for what we do in our community. You can see, at the end of this, there is a patient and it does change lives. You're sitting here doing these mounds of paperwork and these contracts and these billing processes, but at the end of that, there is someone, and their life is being changed. You're making a life for the better. And there hasn't been one of these services where we haven't been touring or walking through it where we don't have someone come up and thank us for everything that WellSpace does. And that's why we want to work here. I think that's why Christie has been here for 20 years. It's just that right there. That's the addicting part about working in an FQHC and be able to help the community.
Awesome. So folks that are listening, let's say they're in the Northern California area or just even outside, and they want to learn more about, keeping up with what WellSpace is doing. How can folks follow the work that you guys are doing? Is it just the website? What would you recommend there?
Definitely the website, www.wellspacehealth.org. One of the other ways is to follow our social media feeds, Twitter feed, Facebook feed. We do a lot on there where we're talking about what are some of the local events that we're doing and that we're engaging in. Also, what are some of those really big campaigns that we're engaging in? We're doing everything from making sure that Medi-Cal beneficiaries don't lose their coverage, right? Of course, after the big rollback of kind of automatic enrollment that had been going on during the COVID-19 pandemic. And so a lot of those campaigns around back to school immunization events or mammogram screenings, you can always find us on social media.
Awesome. Cool. I know Cordia is on LinkedIn. I don't know, Christie, if you're more behind the scenes. I did try finding you as well, but folks, I hope it's okay, Cordia, that I'm mentioning they can connect with you on LinkedIn.
Absolutely.
And so anything else to add, guys, before we wrap up?
I would add that, the great thing about CalAIM is I think it's really easy in government, for a lot of us maybe on the outside of it too, where, where is public policy going? It does seem slow. It does seem methodical. It is frustrating, but this is a program that is long overdue in the Medicaid, Medi-Cal space. And it's really been a long work in progress by the state. Is it perfect? Nothing's going to be perfect that we create public policy wise, but this is derived from another program that was quite successful called Health Homes. Yep. And what we've seen with the social determinants of health is, I've been working in healthcare for now almost 20 years. And I think we've been trying to really put definition to that term. And I think DHCS has given definition to that term when you look at the CalAIM program. And seeing where it's going is that this is what's necessary right now in healthcare. I think we had the Affordable Care Act, which I call the new Big Bang. Remember, we had the 1965 Medicare Medicaid Act, that signed by Lyndon B. Johnson. Not much expansion until we get to the ACA in 2010. And then we didn't see that Medi-Cal expansion to 2015. That solved the access to coverage, but there was a whole other layer that we had to start working through, which is actual access to care, primarily for that Medicaid population, that Medi-Cal population, and understanding what they need. And this is now that time, I think, in healthcare, where we all are looking at just past the primary care setting and the specialty setting into a setting now that can actually have and show dividends and give our patients what they need. And that's what I really appreciate about the CalAIM program. It's going to be slow. It's going to take a lot of people working to get it right, but it's where the program has to go because healthcare is shifting. We have a limit on providers. It's not like we're going to get a flood of providers all of a sudden. So that's what I appreciate. It's in the title, but it is truly trying to innovate care. So, a lot of us out there that may be listening and maybe you're healthcare junkies like us, give it time and be patient. It's a necessary program and it's going to help a number of people that need it the most.
Thanks, Cordia. And while we do maybe need to be patient, we have seen the successes. You gave, or Christie gave the Jose example. My day job, I see it every day. So CalAIM is being successful, but good words, Cordia, for those who still may be needing to be a little bit patient. Christie, anything else to add, whether it's CalAIM, WellSpace, other services, anything to add before we wrap up?
Just to make sure that behavioral healthcare and social determinants of health are never the afterthought when you're thinking about healthcare. So listeners out there designing your systems, listeners out there thinking of remodeling your systems, please make sure that behavioral health and the thoughts and the feelings and the emotions and the behaviors that really determine those primary care outcomes are really thought of as how do we integrate those into services at ground zero? Because that's where we see all that really great payout at the end. Is when we're asking ourselves, what's this person's living condition? What's this person's health literacy? What's this person's access, to food and fresh fruits and vegetables? Because those are the things that we know really make a difference, in the zip code you live in and in life longevity. So always putting in a plug in there to think of behavioral health as an integrated part of any model.
Well said. Well, Christie and Cordia, thank you so much for joining the show today. Take care, guys.
Thanks for having us.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.